Ekang Vir Rasa. Actually, the name suggests Ekang Rog, as the name mentioned. Ekang means either right side of your body or the left side of the body. So that is called as Ekang, either right side or the left side. So when any part of your body, right or the left, especially extremities, are paralyzed or damaged, then this particular drug, Ekang Vir Rasa, will win the battle of that disease which has caused the damage to the half part of your body. So the drug is like a warrior who has win the war. So that's why Veera word is a soldier. So this is the soldier for the damage to the half part of the body. That is why the name Ekang Vir. And when half part of your body is damaged, in modern terminology it is a very perfect word. That is hemiplegia. But unfortunately, Ayurveda doesn't say like that. The parallel Ayurvedic word is a paksha ghat. So paksha word explains about the extremities, either upper extremity or lower extremity or both the extremities. So pakshaghat is a damage to any of the extremities, either hands or legs or both, or maybe right side or maybe left side. So there is no particularness about the word pakshaghat. But in modern terminology, this is very clear, that is the hemiplegia. When all your extremities are damaged, that is called as a quadriplegia. Quadriplegia. And when lower part of your body is damaged, that is called as a paraplegia. So these are the different terminologies which explains about the damage to your lower or the upper extremities. Especially, as you know very well, this damage is a motor damage. That means you cannot work with the hands or the legs. The power of the hands or the legs is lost. Muscular strength is lost. So you cannot write with your hand, you cannot walk with your leg, and that is why we call another name is a paralysis. Paralysis. There is a complete loss or there may be partial loss. Partial loss of the activity is called as, do you know the name? Paralysis. Remember, in hemiplegia there is a paralysis, SIS. And in poliomyelitis, there is a paralysis, total loss of the strength, of the power of the muscles. This hemiplegia is called as a motor problem in your nervous system. Basically, it occurs because of the problem in the brain. In the brain, the pathology takes place. Even Ayurveda says all your indriyas means sense and motor organs, have the main switches, main buttons in your brain. So when main switch is off, naturally you lost the power. So where are the main switches, main buttons of electricity? In the brain. In Ayurveda it is called as a sukshma indriya. Sukshma indriya. Although hands and legs are the karmendriyas, that is the motor organs, but they are adhisthana or the sight. So when you want to treat the Ayurvedic patient, you must know this terminology. Whether the damage is at the indriya, that means sukshma indriya, or whether the damage is at the adhisthana. For example, if I have the arthrosis of the knee joint and I cannot walk, or there is a swelling on my calf muscle and I cannot walk, so that is the adhisthana problem. But when you lost the power because of the damage to the brain, that is called as a damage to the sukshma indriya. Adhishthana damage is easy to cure. Sukshma Indriya damage, that means damage to the brain, is very, very difficult to cure. So, this hemiplegia takes place because of, the modern word is stroke. S-T-R-O-K-E, stroke. Stroke is also called as C-V-A in capital letters, C-V-A, cerebrovascular accident. CVA, cerebrovascular accident or the stroke, hemiplegia, use the tablet Ekang Vir Rasa of Ayurveda, available with Baidyanath and Dabur company. Very cheap drug. 40 tablets cost 55 rupees. Ekang Vir Rasa tablet is available in the market from Baidyanath and Dabur. Also, there is a phytopharma company. Phytopharma, P-H-Y-T-O, Phytopharma company. They have the capsule Palsineuron. Phytopharma company has manufactured capsule Palsi, P-A-L-S-I, Palsineuron. Very interesting word, damage to the paralysis of the neurons. Palsineuron contain Ekang Vir Rasa in addition to the other ingredients. So, Ekang Vir Rasa is available separately. Also, Ekang Vir Rasa available with other herbals and minerals. That is called as a Phytopharma company's Palsineuron. Ekang Vir Rasa has many indications like Pakshaghat or the hemiplegia. Second indication is the Gridhrasi, that is the sciatica. Then Vishwachi is like a problem with the brachial plexus. You cannot lift your hand. Vishwachi. Like for the legs, that is the Gridhrasi, and for the upper extremity, it is Vishwachi. Very similar problem regarding one hand of right or left. Right or left leg is affected with the Gridhrasi or the sciatica. Right or left hand is affected with the Vishwachi. Then there is Ardita Vata in Ayurveda. Ardita Vata is also called in modern terminology facial palsy. Another word of scientist, Bell's palsy, B-E-L-L', Bell's palsy. But not only these 3 or 4 indications, in many Vata Vikar, in many neurological problems, you can use tablet Ekang Vir Rasa. Usually, Ayurvedic UG students, whenever they ask what is the use of Ekang Vir, they will say only Pakshaghat. But PG students say that for all neurological problems, in addition to the hemiplegia, sciatica, Vishwachi, Arditavat, etc., etc. But you must remember the most important contraindication. Because indications are very easy to remember. But you cannot get a success in your practice if you don't know the side effects. Because if the patient suffers from the side effects, your whole practice ruins. So the most contraindication for Ekang Vir, you should not use in Dhatukshejanya Vata Prakop. Ekang Vir Rasa should not be used whenever there is a loss of body tissue. For example, what are the 3 important causes for hemiplegia? 3 important causes for hemiplegia. Only 3. Number 1, thrombosis. Number 2, embolism. Number 3, brain hemorrhage. So, Ekangvir Rasa should be used only in the case of hemiplegia due to thrombotic changes. Better or never should be used in the brain hemorrhage. Otherwise also you know very well that whenever there is a subarachnoid hemorrhage or the brain hemorrhage, 99.9% the patient died at the spot or after some hours. But of course pathology is totally different. Thrombotic changes or hemiplegia is common with the atherosclerotic changes. Whenever the obese patient or having the cholesterol level high, dyslipidemia. In the old age, all our arteries are lost elasticity and cholesterol deposits on it. That is called as a atherosclerotic changes. It may be in the heart, it may be in the brain, it may be in the kidney. So whenever there are atherosclerotic changes, Ayurveda says it is margavarodhajanya vata prakop. So in all these cases of margavarodhajanya vata prakop, obstructive vata dosha vitiation, Ekangvir Rasa is very useful because it contains ushna tikshna dravyas. Ingredients, contents are heat and hot. They do the scrapping, they remove the obstruction, they remove the arm, toxin like material. So Ekangvir Rasa is for problem with santarpanajanya. Ayurveda classifies the diseases in 2 important categories. One is santarpanajanya, that is because of the malnutrition or excessive nutrition or obstruction. And second is apatarpanajanya, dhatu kshayajanya, degenerative, bleeding, loss of rasa rakta mamsa meda. So whenever there is a deficiency, whenever there is a loss, whenever there is a degeneration, no. Ekangvir, no. When the patient has a weight loss, very thin patient, cachexic patient, cancer patient, no, better not use Ekangvir Rasa. You should use the Ekangvir for obese patient, atherosclerotic patient, santarpanajanya, anabolic problems, dyslipidemia, and then he has got the hypertension, then he has got the heart attack, then he has got the stroke or the hemiplegia. You can definitely use Ekangvir Rasa. Let us see the contents. There are 11 Ghataka Dravya or the contents, and Bhavana Dravya are 12. So 11 plus 12. This is the formula. 11 plus 12. Now, in these 11, basically there is a catalyst, that is Gandhaka. Gandhaka sulfur is a catalyst. Also, this is very good antiseptic. It is Yogavahi, that is catalyst, Amapachak, and because of removing the obstruction, it acts as a rasayan. Then another indication content is, I will say the first Tamra Bhasma, because it is also scrapping in nature. So Tamra Bhasma is removing the obstruction, it digests the cholesterol. Tamra Bhasma is a Vishanashak. Pandutva Nashak, that is anti-anemic. It improves the, stimulate the erythropoiesis. Yogavahi, Then there is a Rasa Sindura. Rasa Sindura is also Yogavahi, that is catalyst, Rasayana. Then there are another two Bhasmas like Kantaloha and Tikshnaloha, Loha Bhasma. It is also Balya, anabolic, Rasayan like a tonic, and Rakta Vardak, hematinic, Loha, iron, Tamar is a copper. Then there is a Naga and Vanga Bhasma, tin and lead. These are also Rasayana and improving the all qualities of all the tissues because Shukra Vardaka. Then there is a Abhraka Bhasma, which is very specific, acting on the Majja Dhatu. It is a Narvina tonic, Abhraka Bhasma. Whenever there is a degeneration of the nerves, Abhraka Bhasma is very useful. Then there is some plants, especially for example Nirgundi. Nirgundi, as you know, it is a Vata, controlling the Vata dosha, Anulomana, Vatanuloman, by removing the obstruction. Nirgundi has very specific action also on Majja Dhatu. Similar action is of Shevga. Shevga is another plant which is also Katu, Tikshna, Ushna, Kapha Vatanashaka. Next is Trikatu and Triphala. Trikatu helps in the assimilation of all other ingredients. Basically, Ayurveda believes Rogaha Sarvepi Mandegnam. So naturally, in many of the Ayurvedic formulations, there is a Trikatu and Triphala. Triphala, as I have said, it is also Rasayana. It is also Medha Vardhak. Then there is a Chitrak. Chitrak is a very stimulant, Agni Deepak, Katu, Tikshna and Ushna. So, overall, this Ekang Vir Rasa, generalized, the description has occurred in the Nighantu Ratnakar. The reference, textual reference will be Nighantu Ratnakar. Nighantu Ratnakar says, indication, Pakshagatam Arditam Cha Dhanurvatam. Pakshagatam Arditam Cha Dhanurvatam Tathaiva Cha Ardhangam Gridhasim Cha Api Vishwachi Avabahukam Sarvan Vatamayan Hanti Satyam Satyam Nissamshayaha. Not necessary to write down all the lines because it is a reference from Nighantu Ratnakar, just to get original Sanskrit, what is mentioned in textual reference. Pakshagatam, hemiplegia, Arditam, that is Bell's palsy, Dhanurvata, tetanus, Ardhanga, Grudhrasi, sciatica, Vishwachi, Avabahuk, frozen shoulder, Sarvan Vata Amayan, all Vata diseases. Hantim, Satyam Satyam Na Samshayaha. So it is Ushna Tikshna, basically acting as a Vata Kapha-nashak. Remember, it is Vata Kapha-nashak. Also, it helps to improve the quality of Rasa, Rakta, Majja, Shukra, Ojo, Vardhak and Rasayan. Rasa, Rakta, Majja, these are the tissues in our body. Plasma, blood, nervous tissue, reproductive tissue and immunity, Ojo, Vardhak. It also regulates the functions of heart and brain. Nervine tonic. But Bhavana Dravya, basically Bhavana Dravya, many Bhavana Dravyas are Katu, that is pungent, Deepak and Pachan, digestant and carminative, Tikshna and Ushna and Pitta Vardhak. So many of the Bhavana Dravyas are Pitta Vardhak, which will stimulate the Agni, fire. So first indication, it is useful for hemiplegia, Pakshaghat, but try to understand it, Pakshaghat should be originated from Kapha dosha pathology, anabolic type. If there is a predominant problem with the Rakta and Pitta, basically it is not very useful. Whenever Pakshaghat having the Kapha-Vata predominance, then only useful. As I have mentioned, the patient is having the Kapha-Vardak and Medo-Vardak diet. He is non-vegetarian, eating high calorie diet always. Then this Ekangvir is very useful. Obstructive pathology. As you know, Bell's palsy is also occurred. It is found in the morning. After the night sleep, patient wakes up in the morning and all of a sudden only he has a half face paralysis. It is not related with your hands and legs. It is only on the face. But mostly it is occurring after the night sleep, early in the morning. So what is the night period? It is the Kapha period. Whole darkness is there, Guru Gun is there, Snigdha Gun is there, and that is occurring. That's why it is Kapha-Vata originated, and so it is useful for Bell's palsy. Okay? Then, whenever these Indriyas are stimulant, because of all these other ingredients, they move through the Rasa Dhatu, they improve the blood circulation because of the Ushna Tikshna Gun. Strotorodh is obstruction is relieved, is like a thrombolytic action, I can say. But it is not useful whenever there is a Shuddha Vata Prakop, Dhatukshejanya Vata Prakop, Pitta Prakop is there, Rakta Prakop is there, Dhatukshejanya Vata Vyadhi. That is the Vata problems with the degeneration. Ekangvir is not useful. Then what you can use? In Dhatukshejanya Vata Prakop, there are other medicines, and the immediate connected medicine is Bruhat Vata Chintamani. Remember, whenever there is a hemiplegia and patient is coming from degeneration, having the problem with Vata and Pitta predominance, then what you should use? Bruhat Vata Chintamani. If Kapha Vata origin is there, you use the Ekang Vir Rasa. Are you getting the difference? So another important medicine is a Dhatukshejanya Vata Prakop, Bruhat Vata Chintamani, which, and also another plants like for example Bala, Shatavari, Ashwagandha, Suvarna Bhasma, Raupya Bhasma, Abraka Bhasma. These are very useful for the Dhatukshejanya Vata Prakop. Remember, I am giving you two medicines. One for Margavajanya Vata Prakop, Ekangvir Rasa. Dhatukshejanya Vata Prakop, Bruhat Vata Chintamani Rasa. Because if it is in Ekangvir Rasa is used in unindicated patient, what will happen? There are side effects. There will be burning of the eyes, burning of the skin, gastritis will be there, patient will suffer from trishna, thirst will be there, daha, burning, brahma, that is giddiness, mutra daha, burning micturition, maybe sometime bleeding, rakta pitta, maybe murcha, that is fainting. So all these complications can take place. So in all these cases, it is better to use Shatavari Ghrita, Vasa Ghrita, Kamadudha, Mauktika Bhasma, Tapyadiloha Bhasma. All these are Vata Pitta Shamak. So in the hemiplegia patients, if this type of complications are taking place, all these another group of drugs should be used. But in the hemiplegia patient, if there is a obesity, laziness, anorexia, drowsiness, tandra, snayu shaithilya, laxity of the muscles, and kapha avarana lakshana are there, kapha predominant clinical features are there, then best way you use the Ekangvir Rasa. Second indication is Grudrasi and Vishwachi. Grudrasi is on the leg, Vishwachi is on the hands. Also these are the neurological problems. You cannot move one leg or you cannot lift your hand. Again the same thing. Whenever there is a Vata Kapha predominance, better way use the Ekangvir Rasa. When Vata Pitta is there, you use the Bruhat Vata Chintamani or Tapyadiloha. But of course, first you have to begin with Snehana, Svedana, Virechan and Basti. Snehana is oil massage or oil treatments. Svedana is a fomentation treatment. Virechana and Basti. There is a curious question in the mind of the BMS students especially. I will answer right now over here. We can understand that Pakshaghata is a Vata disease, okay? And Basti accepted because Basti is the best treatment. Medicated enema is the best treatment for Vata problems. But why Virechan? Pakshaghate Virechanam. Why? The people can't understand. Especially I am talking about Ayurvedic students. So, in Pakshaghat, in the text, in Samprapti it is mentioned, it is Snayu Kandara Dushti. Remember, Snayu and Kandara. Dushti is there. Tendons, ligaments, muscles. Then, you think about the Upadhatus. What is the Upadhatu of Rasadhatu? Stanya and Raja. What is the Upadhatu, secondary tissues from the Rakta? Sira and Kandara. Do you understand? So Upadhatu, secondary tissues of Rakta Dhatu is or are Sira and Kandara. Sira, vessels. Kandara, tendons. Ayurveda believes that in hemiplegia there is a problem in the blood vessels, there is a problem in the tendons. Is it clear? And which are connected? Connection is where? Connection is with the Rakta Dhatu. Is it clear? Rakta Dhatu. To whom it is connected? Pitta dosha. Try to understand. Sira Kandara connected to, that means physiologically, I am not saying anatomy connected to, physiologically connected to Rakta Dhatu. Rakta Dhatu is physiologically connected to Pitta dosh. And what is the best treatment for Pitta dosh? Virechana. That is why Pakshaghate Virechanam. PG student must answer this at the time of exam. Very important. Ardhita, I have already described. This is the problem with the facial nerve. And my video is also there, how to test your nervous system. How you can test the facial nerve? Only 4 tests. You can ask to wrinkle the forehead. This is the test for facial nerve. You can ask, close your eyes tightly. The patient will not be open, that is normal facial nerve. Ask the patient to blow the cheeks. This is normal facial nerve. Then blow the whistle. This is normal when facial nerve is normal. But wrinkling will be damaged. There will be not proper closing of the eyes. There will not be proper blowing of the cheeks. There will not be proper whistling through the mouth. So all these indicate that facial nerve has been damaged. Again, whenever there is a Kapha Vata predominance, you use the Ekang Vir Rasa. Okay? So this is, I think, all about the Ekang Vir